A good evening to all of you. Thank you so much for watching Family TV. Actually, I credit you for having watched Family TV from morning up to this time. Thank you so much. Of course, you're the reason we are. Without you, we wouldn't have been operating till date. Thank you so much. I believe your day was a beautiful one. And thank you also, you who has been anxiously waiting for Health Pot. Of course, this is a health program. And not forgetting that this program is brought to you by Makerere School of Public Health together with Family TV. And we are basically looking at maternal health. But today's program is a special one. And guess who we have today? We have Dr. or Professor Peter Waiswa. He's going to give us an overview of this program. You who are still asking yourself, but what is the whole essence of this program? Here's the answer today. Doctor, you're most welcome on Health Pod today.
Thank you so much.
Kindly greet our esteemed viewers, and they would also need to know who Professor Peter Waiswa is in detail.
Good evening, viewers. Sorry, I have a mask, so you can't see my face very well. But I'm Professor Peter Waiswa. I'm an associate professor at Makerere University, School of Public Health in the College of Health Sciences. I also do a lot of research. I'm an expert on the health of mothers, newborns, and children, but also adolescents and our health systems. And I'm involved in work in Uganda, but also work around the world. Actually, I'm an advisor to the WHO Director General in Geneva on issues of mothers, newborns, children, nutrition, and adolescents. Thank you.
We are excited that we have you today, Doctor, and I believe we have the resource that we needed. So, Doctor, of course, there are very many grafted names, very many beautiful names that given programs. But among all the names, why did you come up with this name, Health Pot, and not any other name?
So first of all, as Makerere University, we thought we are a country of younger people, and these younger people are the future now, and they will drive all the development and welfare in Uganda. We thought we should design a program that helps families be able to look after very well their children from the time before they are born through the time they are pregnant, the time when they are giving birth, and the time after delivery, and later until the child is 5 years and maybe later becomes an adolescent. So we call this program Health Pot. And because when you look at families traditionally, the pot has always been at the center of the family. The pot is used to cook, it is used to serve, to store things, to have water, and many times it brings families together. Yeah. So that's why we are using this symbol of the pot as the focus of our health program, hence the name Health Pot.
Wow. So all the questions are now answered. Why Health Pot? Why among all the objects we choose a pot? But of course you've actually enlightened it, and I think whoever had that question has been answered. So Doctor, why did actually the School of Public Health take up this program?
So first of all, as a university, especially during this time of COVID, we've realized that we can no longer just depend on people who come from abroad. We Ugandans, we must provide the leadership, and the expertise is in the universities. We would like to bring down what they say, bring down the ivory tower, to bring down the university to the people. And one of the areas we thought is important, actually, this program is going to be focusing on two important areas. First of all, what we call early child development and nutrition, which focuses on children. As I said, from the time before even a child is born, we should be thinking about the welfare of children. We should be ready for them. So before the child is even met, later until the child is 18 years. Because that period is quite important in the development of the children. And as you know, right now in Uganda, we have this situation of COVID, children at home. What can families do to make sure that this child is stimulated, is well brought up, is healthy, and is the future of the country? So that is the part which is early child development and nutrition.
Still, on early childhood development, what are some of the expectations when it comes to early childhood development? Because early childhood program or development seems to be something wide. And what are some of the expectations that our viewers should be waiting for?
So maybe a starting point is, for us, we as scientists, we know that the first 1,000 days, which is from the time the egg and the sperm combine to form a baby, up to the time the child is 2 years, are the most important days of any human being if he is to grow up as a responsible, bright, smart, productive, well-engaged human being. Everything happens in the first 1,000 days, from the time the child is made to the time when the child is 2 years. But these days we actually talk about even 2,000 days, which goes up to 5 years. So basically we are trying to say you can't neglect the life of a child in the first 5 years. If you do so, you actually miss the opportunities of having this child very productive. This other education we get later in life is important, but everything is set up in these first days of life. And if we don't do them well, then everything will not be the best. The other one is to do with nutrition. If children are not well nourished when the child is in the womb, and they are not cared for very well when the mother is giving birth, or immediately after giving birth, up to 5 years, then they can get malnutrition, and that affects the health of the brain, the functioning of the brain of the child. And that child will not be as bright as is expected. And we're in a country where there's a lot of competition. But also the other thing which is important is that when we do a very good early child development program, then we actually get workers who earn more, they will work better, but also they will be more healthy. So what you do in the first 5 years of life, what you do during pregnancy and the first 5 years of life, affects what you will be as a human being later. And if you miss this period, then you have missed a big opportunity. So we want to combine the care of the child, the nutrition of the child, and also the education of the child during this time. Let me just clarify one thing about education.
Education, okay. Yeah.
Because education in this time, we don't necessarily mean that the child must learn to read and write, but the child must learn to be stimulated, to coordinate, and also to relate with its peers, to be socially interacting and engaged and stimulated, so that you prepare this child for now learning the math, the reading, and stuff like that. All that is important to happen in these first 5 years.
So this, Doctor, this is early childhood development. Then what else? Because you told us that we are looking at basics, and one of them is early childhood development. So what else are we looking at?
So we are going to focus in general on the health of the mother, the child, and the child, but with a special focus on early child development, because we know that this has not been given enough attention. So over time, we are going to discuss several things, like how do you, as a family, prepare to have a baby? So the health before, what the things you must do before you even prepare to have a baby. You prepare to get pregnant. Then once you become pregnant, what are the right things to do during pregnancy? Health care, nutrition, but also how do you stimulate the baby who is in the womb? And then after, how do you ensure that the child is born in a good environment? Then after the child is born, how do you care for this child when it is a newborn? And how do you stimulate the baby, this very small baby, stimulate the baby so that the intelligence of the child begins to grow and the brain becomes bigger and functional. And then later, how do you care for the child from the first month of life until 5 years? But also, if we later, I think we should be able to go into like the health of adolescents. When our children make 5 years and between 5 and 15 or 18, how do you care for them? What are the things that should be done right?
So, doctor, what you want to mean is that the care given to children between 0 to 5 years is different from the one given to those from 5 years to above?
It is different because, 0 to 5, the child is forming. But after 5, the child is in school, is interacting with the different environment, is running around the roads, riding bikes, and so many things like that. And then the impact of peers and all these pressures in society. So the care is different. So we are going to
In other words, one of the other things that we are looking at in this program is the role of parents in child upbringing.
So this is health court, and which focuses mainly on the role of the family, the mother, the father, other adults in the family, even the siblings, but also the community, because families are in communities, and then the society. So we are going to be talking what is the role. Child care is not just for the mother, it is also for the father. But many times we also have maids. What can a maid do to make sure that the child is well cared for beyond just feeding the child? Can the child be kept stimulated when the mother and father have gone to work? The second program we are going to focus on.
Or maybe, doctor, let us shortly go for a commercial break, and then we'll come back. We are going to we'll start from that second program that we are going to talk about. We are coming back shortly.